Lecture PHS 223, and the course title is Demography and Social Statistics in Public Health. My name is Dr. Isagboin Henry, and you are welcome once again to this class. I want to appreciate you for the last session, the last semester, for how you were well behaved and you took time to study your materials and it reflected in your exams. And I'm very much aware from the results that majority of you scored distinction and only few of you had a credit. The other majority had B, and that's an excellent output. I am believing that in this course as well, all of you in 200 level, you will do excellently well. And so I want to encourage you, like you know, the way and modality with which we take this exam. So the way and manner we take our lectures, I will be in class to have a summary of each of the lessons notes that have been uploaded, and to also take all the questions that have been asked on the Google Classroom. So if you are not on the Google Classroom and you have this video, you are not doing yourself any good. You're expected to have joined the Google Classroom via the link and also download the videos, watch, pause, write, and do all that you need to do to aid your understanding at your convenience, and ask your question on the Google Classroom comment section. So when I come around, it will be a very robust session where we discuss and then we have good time, understanding this course. It's a very simple one. I'm sure you all know from the topic, demography and social statistics in public health. So let us now see this course as we go through it gradually. What is the course objective for this course? By the end of this course, you should be able to demonstrate a clear understanding of the basics of demography. You should be able to discuss the importance of demography in health issues. You should also be able to describe social demographic variables and their effects on population composition and growth. You should be able to explain the role of knowledge, attitude, and practices as demographic tools in public health research. You should be able to discuss the implications of population mobility and its consequence on public health. You should be able to identify and interpret demographic health data. Now let's see the first discussion under lesson note 1, and that is the definition and scope of demography. Remember, we are treating lesson note 1, which is titled Introduction to Demography and its relevance to public health. So let's see the definition and scope of demography. In detail, demography is a scientific study of human population where it examines their size, their structure, their distribution, and the changes over time. In fact, it provides the foundational data that is needed for public health policy, research, and intervention design. By analyzing population trend and dynamics, demography helps in understanding how populations grow, how they change, which in turn affects healthcare demands or influence the resource mobilization or allocation, and also the way and manner the planning will have to take place. And so demography has a very serious impact because it will examine the factors such as birth rates in that community, the death rate in that community, the way and manner people migrate in and out of that community, and the overall composition of population. And we also see that demography also looks at both the social, economic, and cultural aspects of a population group. What are the key terms? Those key terms that actually affect the scope of demography. Those key terms that has a very strong influence when you mention a population. Number one, size. Number two, distribution. Number three, structure. Number four, change. Number five, development. Let's look at them one by one in detail. In terms of size, this refers to the total number of individuals within a given population at any given point in time. Understanding population size is essential for determining the capacity required for various services like the healthcare they need, education, and housing. For instance, a large, rapidly growing population may need more healthcare infrastructure compared to a smaller, more stable population. So you see the effect of size, where the total number of people in a population is looked into. And so that will determine what kind of healthcare service they will get, to what extent of educational facility they will get, and to what extent of housing facilities they will get. So a population that is growing will require more compared to a population that is more stable. Number two, distribution. The arrangement of people across geographical regions. This could be related to urban versus rural settings, where you compare those in the urban and those in the rural. Of course, you know what is the urban and the rural. In the urban, you have a lot of facilities. People tend to migrate to the urban because of the opportunities that abound. Socioeconomically, you tend to thrive more, you make money, and all that. The opportunities are there. So it is believed that people have to move from the rural to the urban because of the presence of governance, because of the presence of infrastructure, and so on. And so the rural settings have less compared to the urban settings. Going further, this could be related to regional variations within a country or between countries. And the distribution of the population determines where health resources should be allocated. Now, when resources needs to be distributed, population distribution needs to be looked into so that we know to what population, to what how will I put it, to what quantity, to what volume does each area need to get within a particular set of population. Now, the distribution of this population determines where health resources should be located and where public health programs should be most heavily focused. For example, an influx of people into urban areas may require increased healthcare facilities in cities. Number three, let's look at the structure. Structure is very important. Population distribution based on age, based on their sex, and other factors. Now, when we say structure, it has to do with or refers to the breakdown of the population based on categories. And other factors include socioeconomic status. This demographic factor is critical in understanding who is most at risk for certain health issues. Now, look at this example. A country with a higher proportion of elderly individuals may face different healthcare challenges. For example, they could come down with chronic diseases and geriatric care. So, they need a care because they can no longer walk on their own. They are no longer agile. They are no longer strong. They are now aged. Compared to a population with a higher proportion of young people like you and me. In other words, in our own community, we would need more maternal health and childhood immunization. Why? Because we get married, young chaps, and then their wives, get pregnant, children. These children will need immunization. And so you look at that population, what set of people are there. That will determine what kind of resources you need to move to that area. Next is change. Let's look at change. Changes in population are driven by three primary factors. Number one, fertility. When we say fertility, we mean the rate at which people give birth rates. Mortality, it also talked about the rate at which people die. And migration, that is the rate at which people move in and out, be it by force or by voluntary. Now, fertility rates determine how quickly a population grows, while mortality rate indicate how many people die in a given period. Now, migration, like I told you, be it voluntary or forced, affects population distribution and the composition of a population, because people are going out and people are coming in. And so when this happens, there is a net change. If 3,000 people came into this community last month, and due to insecurity, by force, 160 people leaves, you are left with 140. And so there is a net change. Demography change is vital for predicting health needs. For instance, health migration rates could lead to new public health challenges, such as the spread of infectious diseases. Oh, a set of people have just come into this community, and we discovered that when they came, virtually everybody is coughing. That tells us that there is a need to also intervene. Otherwise, respiratory infection will soon go around the entire community, and that will be disastrous. So that will determine what intervention, what new public health challenges do we have on our fingertips that requires intervention. And finally, let us look at development. This involves socioeconomic changes such as urbanization, technological advancements, and increased levels of education and employment. Now, these changes impact health outcomes by improving living standards, by improving access to healthcare and overall well-being. So you go to a community because you discover that there is a police station there. You go to a community because you discover that the local government is in that community. You go to a particular local government, a particular area to settle down. Why? Because you understand that in that area there is a university there. And so you feel it will help your business thrive. You go to a particular area because you hear that some group of politicians built their houses there, they live there, and so it is believed that development will be drawn to that area, if probably in the future it will become a GRA, a government reserved area. And so on the other hand, poorly managed development can exacerbate health disparities, as seen in rapidly growing slums where health services are inadequate. So people leave those areas. Why? Because they are poorly managed. And because they are poorly managed, you can guess that in the future there will be a serious, health disparity here. Disparity in the sense that there will be no health care. You will see a lot of children, a lot of pregnant women, no public health center to really help them. And you will discover that the community will be dirty, no security, no police there, and so on. And so people tend to leave those areas to a more developed area. So you see that size, distribution, structure, change, and development all affect the scope of demography. They all have serious influence on the demography, on the social economic factors of any community. Let's go to the second one to see the importance of demographic data in planning and policy. Now that we have seen the factors, let us see the importance of demographic data. Let's see that now in planning and policy. Why do we need demographic data? Is it important? And by the way, what are demographic data? Demographic data is essential for effective public health planning and policy formulation, and it provides valuable insight into health needs assessment. 2, resource allocation. And 3, identifying health needs. This is very, very important. And you cannot afford to play with it. You cannot afford to just shave it aside, because demographic data, by all means, will help you able to see these three things we have just talked about. Now let us see it in detail. Health needs assessment. Understanding the size, understanding the age and sex distribution of the population will help identify the health needs of various groups. For example, a growing youth population may require increased mental health services, while an aging population may necessitate expanding geriatric care. For policymakers, knowing which segments of the population are most vulnerable to specific diseases will allow for targeted intervention planning. For example, high fertility rates in certain regions might prompt maternal health programs or vaccination initiatives for young children. And so when we look at the need, we assess the need. Because of the data available, we know where to put in our efforts. Also, when you look at the community, you are able to understand the rate at which the fertility is going, and therefore you can plan. These people, we need more public health centers. These people, we need more security, outposts. These places, we need more good road, because there are a lot of young men and women who now go to farms, and so they need their crops to be moved to the main hub so that they can, sell them and make money. That way, job is provided. And so all these assessments are key. Number two, let's look at resource allocation. Now that you have a good assessment, you want to look at how can we go about allocating what we have, because we do not have them in enough. We do not have them in a large quantity, but the little the nation has or the community has as a local government, as a state government or federal government, you want to ensure that they are properly allocated. And so, under resource allocation, accurate demographic data enables effective resource distribution. For instance, healthcare facilities, you want to distribute them. Medical staff, we don't have enough, but we need to distribute them. Vaccines, we don't have enough, but we need to distribute them. And we don't want vaccines to go to the wrong place where to be wasted. And medications can be allocated to regions with high population density or higher incidence of the diseases. Oh, there are more children here. There are more births here. There are more young child between the age of 2 to 5 here. Let us move the vaccine to these areas. There are more adults here. They will not need the vaccine. Just only few children are there. We can say, okay, let these people travel to this particular area, or we send few vaccines to that community. That way, these vaccines move in the right proportion at the right time to the right target. Resources can be directed to areas where healthcare system is least equipped, such as rural or underdeveloped regions. Therefore, inaccurate data may lead to under-servicing or over-servicing, certain areas exacerbating health disparities. In other words, when you have an inaccurate data, it will affect your resource allocation. So you see the importance of demographic data. That's why when we collect data, you must ensure that your data is clean, your data is polished, your data is correct. Let's say the third aspect, identifying health trends. Identifying health trends. That's one of the importance of demographic data. It will help you to identify health trends. So tracking demographic changes such as increasing life expectancy, aging populations, or migration patterns can provide valuable insights into future health trends. For example, the rapid growth of an aging population may increase the prevalence of age-related chronic diseases like dementia and arthritis. Very important. When you see that there is rapid growth in an aging population, of course we know they suffer a lot about dementia. They don't remember again their date of birth. They don't remember where they last worked. They don't even remember sometimes their extended family. Why? Because of the problem of dementia and arthritis. They no longer can walk. So when you see that group, in this community, in this area, we have a lot of aged people there. In the last count, that tells us that in that community, the public health center will be dealing with a lot of cases of dementia and also possibly arthritis. Such trends enable policymakers to anticipate and mitigate challenges before they become a significant issue. So you see them ahead, you understand the trend ahead, and as a good policymaker, as a good public health official, you are able to prepare ahead of time to be able to counter those challenges when they come up. Similarly, demographic shifts from rural to urban living may prompt planning for urban health needs, such as pollution control or access to health care. And so you see the population growing, and you know that this will lead to a population, a community that could end up become polluted. And so you need to control the pollution, waste management, and also the access to health care, so that when there's a pandemic or epidemic, you are able to handle it however it comes. So you are prepared for such incidences when they come. So you see how interesting the importance of demographic data can be. So we have looked at health needs assessment as very good importance of demographic data, because demographic data will help you to have good health needs assessment. It will help you to have good resource allocation. It will help you to identify health trends. Let's move to the third one, the third topic under lesson 1, overview of demographic methods in public health research. The overview of demographic methods in public health research. Whether you like it or not, it's important that you understand now that as a public health student, you will be taking part in a lot of research. Research is key. It is the very backbone of public health. And therefore, when you want to have an overview of a demographic area, you will need to carry out research that will give you the picture, that will give you the data, that will give you evidence on which you base your decision. Now, demographic methods are used to collect, analyze, and interpret population data to inform public health research, and they include census data. That's one method. You get information. Vital statistics, another method. You get, information. Surveys, that's another method, and sample registration system. Now, we'll look at it in detail. Demographic methods involve collecting, like I said, analyzing and interpreting population data. Why? So that you can inform public health research and then make good decisions. Now, these methods enable researchers and policymakers to understand population dynamics and health behavior. Now, when you have this data, you can look at a population, understand the dynamics, and you can understand the behavior. You can understand what is going on, like I told you before now in the last discussion on the health trends. Now, let's see those demographic methods, how those data are collected. Number 1, census data. Census data. In terms of census data, it's a comprehensive and systematic count of a population. And I'm sure you probably have experienced census. Now, it typically collects information on the age. They move house to house. They will count everybody there, take note of their age, take note of their gender, take note of their education, are they employed, and the household composition. Census data is fundamental for identifying national and regional health trends, such as the distribution of chronic diseases or mental health issues which arose between different age groups. Now, this data is often used to determine federal and state funding for public health programs. So, in the end, the census data will help the government to be able to plan, both at the federal and at the state level. Number 2, another type of demographic method of getting data, you have vital statistics. Vital statistics. Now, vital statistics track events like births, deaths, and marriages, providing essential data that will help you understand population changes. So when more people are given birth, the population is increasing. How many died, the population is reducing. And how many, the difference between the two, you now have the balanced net rate and the key indicators for measuring fertility and mortality. Now, this can inform policies related to maternal health, child mortality, and also in aging populations. Additionally, You have the case of marriage and divorce statistics. So more people are getting married. You know what that means? More children is coming. Ah, this will help you to be able to measure the fertility and mortality, which can inform policies related to maternal health, child mortality, and aging populations. Additionally, marriage and divorce statistics can shed light. It can shed light on the social trends that may impact family health, such as single parent households and the associated health care needs. The next method is survey. Under survey, you have population surveys such as demographic and health surveys. That's your DHS, demographic and health surveys, because they provide detailed insights into health behavior. They provide detailed insight to fertility rates, mortality factors, and access to healthcare services. So we know how many persons in this community have been accessing the public health centers when we carry out our survey. Surveys are often more flexible compared to that of census data and allow researchers to gather more detailed, more context-specific information. In fact, they help the public health researchers and policymakers to understand the behavioral, social, and cultural factors that influence health outcomes. For example, surveys can identify the prevalence of smoking, the prevalence of obesity in specific regions, guiding public health intervention strategies. So when you have a good survey, you can tell the level of insecurity in a community, how much people are smoking, how prevalent it is, and how people are now enjoying their lives and they are becoming obese. And also you can begin to understand the health interventions that are needed in a community because you have done a survey. Finally, under demographic methods, you have the sample registration system. The sample registration system. The sample registration system is used to collect representative data from a specific sample of the population. Note that word, a specific sample of the population. You look for one particular area and then you specifically go to that area to get the data. It's not general. Now, this system estimates both mortality and fertility rates in regions where it may be difficult or expensive to conduct a full census. So you go there, you get your data, and you use that data almost like a kind of replication, a kind of general conclusion for a certain area that fits it. Instead of going around the entire community to do a full census, by providing a snapshot, that's why it's called a snapshot of the population dynamics from one area. We look at that area and say, okay, we can use this as an inference to discuss or to conclude with the other areas around that community. This system helps track trends in health, disease outbreaks, and demographic shifts. And so, under the overview of demographic methods in public health research, we have just seen the different methods. 1, census data. 2, vital statistics. And 3, surveys. And 4, sample registration system. Let us see the final one under lesson 1. As an introduction, remember we have been taking them one by one under lesson 1. The final lesson 1 sub-discussion is applications of demographic data in public health. Now we have seen the type of data, we have seen the methods, we have seen how to get them. Let's now see how to apply them. Number 1, we apply them in health program design. Number 2, we apply them in monitoring health outcomes. And number 3, we apply them in predicting future needs. Demographic data has several practical applications in public health, enabling the creation of effective health programs, monitoring health outcomes, and predicting future health needs. Now, in terms of health program design, demographic data is essential for the design and implementation of public health programs. For instance, data showing a high birth rate in a region might lead to the creation of maternal health programs, whereas data on low vaccination rates may prompt vaccination drives targeting children. The needs of specific demographic groups such as pregnant women, the elderly, or children can be identified and catered to with precision. So when you have good data, correct data, it will enable you to be able to plan programs in that community to target, to intervene, and to handle certain challenges. Number 2, as an application is monitoring health outcomes. When you have good data, as a public health official, you can use those demographic data to assess the success of health intervention. How far have we succeeded in all the interventions that we have been doing all this while? For example, after implementing a vaccination program, demographic data on the incidence of preventable diseases can help determine if the program is successful. So we have done a program against malaria, we have done a program against viral diseases. We have done a program against, bacteria, invasion in a particular canteen or vendor where people eat and so on. And then now we want to go and assess after a few months if what we did, the education we provided then, really did work out. And so we want to see how many persons are now coming to the public health center with diarrhea, constipation, food poisoning. And we see that the data has reduced. Oh, very good. We had a program the last time. We have gone back to monitor it, and we have seen that lesser people came down with those problems as it were 6 months ago before that program took place. In case of vaccination, how many people are coming down with issues of polio? We need to find out, and this has helped a lot. So monitoring these outcomes over time helps to identify the patterns, measure the effectiveness of health policies, and improve future interventions. And this is crucial in adjusting strategies based on observed data and trends. Finally, predicting future needs as an application of demographic data. As population change due to factors such as aging, urbanization, or migration, demographic data helps predict future healthcare needs. For instance, in countries with rapidly growing elderly populations, population health strategies might shift toward focusing more on those elderly people, the geriatric care, chronic diseases management, because they come down with it a lot, and long-term care facilities. Projections based on demographic trends allow the healthcare system to be prepared for upcoming challenges so that they can ensure that the adequate resources, services, and policies are put in place for this particular community. And so, with this, we've been able to have a thorough discussion on lesson note 1. So, in conclusion, demography plays a pivotal role in shaping public health strategies. We have seen that it provides the foundation for understanding health needs, allocating resources, and crafting policies that improve the overall health of populations. Understanding demographic trends is crucial for addressing emerging public health challenges and ensuring that health services are effectively distributed to meet the needs of all groups. At this juncture, I hope that you take time to read, to listen, pause, make notes, and if you have questions, send your questions to the comment section of the Google Classroom. With this, we come to an end of lesson note 1 under the topic Demographic and Social Statistics Public Health course. So, I'll see you in the next video. And in the next video, we will be talking about the topic population size and composition. The topic population size, composition, and distribution. So until then, remember, make sure you take your notes. Very important as you listen. See you